Good morning, good afternoon, everyone. I'm here to talk about how AI, ML in healthcare, manufacturing, building resilient in PPE supply chain through data-driven innovation. It's a truly honor to be here at the Applied AI Summit. My name is Natarajan Ravikumar, and I represent Honeywell International. I want to take you on a journey through the crisis that shook healthcare supply chains to their core, through the vulnerabilities that surfaced, and into the future that artificial intelligence and machine learnings are making possible. Our focus will be how we can build resilient intelligence and sustainable healthcare manufacturing ecosystem, especially for critical protective equipments like N95 masks, gowns, and face shields. I'm going to quickly take you to the next slide. That's going to talk about how the crisis that changed everything. So when we look into the crisis, the COVID-19 pandemic exposed weakness that we didn't know or perhaps didn't want to admit existed. Hospitals worldwide faced shortages that they were almost unthinkable of N95 masks, right? Surgical gowns or ventilators and more. What we saw failure for our traditional supply chain models is optimized only for efficiency, cost cutting, and not resilience. So, in other words, the system designed for just in time completely broke down when they need to be just in case. The crisis actually was not only good about supply, it is about protecting the frontline healthcare workers, and that gave us the new lens to ask, how do we design smarter or adaptive or AI driven supply chains that can anticipate disruptions rather than just to reach to it? So, what we're going to do is we're going to move to the next slide and see how the forecasting gap plays a critical role. One of the biggest breakdowns was forecasting. Healthcare institutions relied on historical data, right? Most flu seasons to predict demand that worked at normal times. But during COVID, this was actually meaningless. So, for example, the demand in N95 masks skyrocketed far beyond any historical baselines because forecasting lagged and we ended up with the bidding wars. Price surged over 100,000, cost billions, and leaving frontline workers scrambling. Beyond price, there were operational blind spots, right? So many hospitals didn't even know the true consumption rates in real time. So outdated inventory systems gave minimal visibility. And that means that slow responses wasted resources and stress to the healthcare staff. So in the AI ML, we're going to address this is on how we combining the real-time data and the epidemiological models and the predictive analysis for forecasting and the demands that met dynamically. So in the next slide, we're going to talk about how the AI ML in revolution in manufacturing, how it plays a critical role. This is where the revolution begins, right? Artificial intelligence and machine learning, when combined with the industrial Internet of Things and manufacturing execution systems, create an ecosystems that can respond in real time. Instead of just reacting to crisis, these intelligent system anticipates problems, suggested solutions, and optimize operation automatically. Think of it as I'm moving from a rear view mirror to a predictive GPS. So one of that doesn't just tell you where you are, but where disruptions might arise and how to route and around them. So what we're going to do is we're going to move into our next slide to talk about how AI-enabled quality transformation takes place. In the AI-enabled quality transformations and the intelligence inspection system, let's talk about quality, right? In the traditional human inspectors look for defects in PPE and medical equipments, but humans miss details. What specifically means that microscopic flaws, right? Now, with computer vision and AI, inspections happens very faster. So more accurately or more constantly, the AI can detect actually micro defects, very dimensions, right, and ensures the assembly precision. So all while learning the past due to improve. This means that less waste, fewer recalls, and safer products reaching healthcare workers. And because of these systems connects directly to the MES and the Internet of Things platforms, feedback is the instant allowing for protective corrections. This is what do we get the results out of it, right? The results is like higher reliability, lower cost, and better protections in the frontline staffs. So these are all the benefits that we see how AI enabled in the quality transformation. I'm going to take you to the next slide, which we're going to talk about more in terms of like how predictive maintenance and its excellence. In the predictive maintenance excellence slide, we're going to talk about the sensor integration, pattern recognitions, predictive alerts, and optimized scheduling. In another area is the predictive maintenance means instead of waiting for machines to break down the mid-productions, AI help us to act before the problems actually even occur, right? So we're going to consider as 3 points. The first one is the IoT sensor, continuously monitor equipment, tracking vibrations, temperature, and pressure. The number 2, we're going to discuss about how the ML model analyzes these patterns, flagging anomalies. Number 3 is the system then recommends maintenance days or even weeks in advance maintenance. This means that fewer unplanned shutdowns, smoother productions, and more consistent supply chain crisis during crisis. It is like healthcare for machines, right? Catching up problems early before they even become critical. So those are the important key aspects that we even think about how predictive maintenance plays an important role. And so we're going to deep dive into more of how the digital workforce transformation happens in the next slide. So in the digital workforce transformation, AI is not just about machine. It's about it's about the empowering people, right? So we're going to discuss how it's going to be in the accelerated training, enhanced flexibility, and the rapid response. The digital systems now reduces training time by about 60%. Workers can learn faster with augmented reality overlays and real-time guidance. So this is also makes the workforce very more flexible. They can move quickly between product lines and adapt to disruptions without long learning curves. So in the moment of crisis, actually the agility becomes invaluable. So, these are the important part of our workforce transformation. I'm going to take you to the next slide where we're going to deep dive a little bit more about sustainability through intelligence. So in the sustainability intelligence, AI is just not about resilience, right? It's about responsibility. And in the healthcare manufacturing field, AI helps reduces material waste, optimizes energy consumptions, and conserve water. For example, predictive maintenance analytics can just HVAC systems for efficiency, identify wasteful machines, or optimizing cutting patterns to minimize the scrap. So this is just about for good for business. It's critical for the planet as well. By embedding intelligence in it, we can actually make the healthcare manufacturing much more greener and more sustainable. And that's what we are focusing on. Moving to the next slide, we're going to talk about how key success factors for AI ML implementation, and then how it plays a key role. So there are 4 topics here about strategic vision, leadership investments, technical foundations, and workforce adaptability. So in the AI adoption is much about culture and is about technology. Without change management and leadership commitment, the tools won't fulfill their potential. Any AI/ML adoption requires a comprehensive organizational transformation, right? Moving on to the next slide, we're going to talk about how adoption challenges remains. So adoption challenges remains on the three parts, right? So number one is the infrastructure barriers. Number two is regulatory compliances. Number three is skills gap. But let's be honest. This is not just easy, right? Because smaller manufacturing often lack IT infrastructure to support the AI activities. But healthcare manufacturing is heavily regulated, which means compliance is hurdle. And there is always a critical skills gap. We simply don't have enough experts to train at the intersections of AI and the manufacturing. So these are the barriers actually real, but it's actually not insurmountable. So with partnership investments and training, we can overcome all these issues. And in the next slide, I'm going to take you to how building long-term resilience. So in the building long-term resilience portion, we need the pillars of transformation, right? And how AI/ML technologies are foundational, creating resilience as well. So how do we actually build resilience? We need 5 pillars: enhance data integrity and visibility, and predictive analytics and AI forecasting, flexible in the automated manufacturing, and digital twins and stimulations, and sustainable advantage. So together, these forms the foundation of supply chain that can actually withstand the future crisis. So in the next slide, I'm going to talk about how the strategic framework for implementation and what do we do for that. In the strategic framework of implementations, the strategy matters. The implementations works best when the assesses the capability honestly, and start with the pilot projects that shows value, and scale successful pilot across all the enterprises, and continuously optimize. The journey is iterative, and each steps build confidence and momentum for a larger transformation. Moving on to how actionable recommendations plays an important role for this. So investments. So what does organizations do today, right? If we look into it, so we invest in foundation infrastructure, IT and data infrastructure, and we build partnership and with providers, with universities, and consortia, and all those partnership has to be built. And we prioritize the workforce development, right? How do we create comprehensive training programs, that combines all these technology skills and the change management that ensures the successful technology adoptions with coming new technologies, and et cetera. So there's a very crucial and important factor. And embrace the regulatory collaborations, right? Not just the compliance, but we need to co-create the frameworks that encourages the innovation. The action bridges the gap between the potential and the practices. So I'm going to take you to the next slide, where we're going to talk about the future of resilient in healthcare manufacturing. Looking ahead, the question is no longer, should we adopt AI in healthcare manufacturing? So the question is, how fast can we do it? Those who move quickly will not only protect their supply chains, but also drive the global health equity, ensuring access to life-saving products worldwide. As I often remind my teams, the future belongs to those who prepare today for tomorrow challenges. So this is very important. Moving on to the key benefits in intelligent supply chain. So if we, let me leave you with a snapshot of what intelligent supply chain actually deliver, right? So reduces the lead time. We're talking by up to 30%. And improve the inventory accuracy. We're talking about 15 to 20%. And then faster disruption recovery, much about 50% safeguarding the patient care. And enhanced quality control. Sometimes, it's the reducing the defect rates by about 25% too, but consistent product quality, enhancing them. And that being said, I'm going to stop there and say thank you for your time and attention today. As we reflect on the lessons learned on the COVID-19 and the opportunities ahead, I encourage each of you to think about how we can leverage AI and ML to build more resilient, adaptive, and sustainable healthcare supply chain, because the next crisis will come, but if we prepare, it won't catch us unprepared. Thank you.